Hi, in this video I'm going to show you how to administer steroid injection for trigger finger and tennis elbow. Here I have a 44-year-old Bidayuh lady with both conditions, so I've decided just to include one video. First part, this is demonstrating the triggering of the finger, which happens to be the left thumb in this case. Right now, the first thing is to identify, to locate where you're going to give the injection. It's actually where the tender nodule lies, and when you have identified that injection site, then you will proceed by swabbing the area with hibitane, iodine and alcohol, followed by application of ethyl chloride spray to numb the surface of the skin before injecting. Now, because the swollen tendon, the nodule, is actually very small, so you don't need more than 0.5 cc of triamcinolone, and the one that I use comes in a standard vial of 40 milligrams per milliliter per mil, so you only need half of that. Okay, you actually see the triamcinolone oozing out because there's only so much you can inject in such a small area. Just swab that off, and then you rub the remaining triamcinolone that you have injected, rub it on to work it on the nodule, and once you've done that, you apply the Handy Plus plaster, and then the next thing is to immobilize the joint to facilitate the healing. Of course, there are many ways you can do this. Over here I'm just using self-adhesive bandage because, well, I prefer them because they stay in place when the patient goes to sleep in the night, and the bandage is supposed to be kept overnight and only to be removed the next day, so it is important that it stays in place. Now, whatever steps I have shown here applies for, you could use it for the other fingers, other affected fingers, the same technique, right? Okay, you ask the patient to flex the thumb or the finger to make sure the bandaging is not too tight, and also to check on the triggering. Now, sometimes the triggering can actually disappear almost dramatically, and well, in this case the response was a little bit delayed, but this lady has had this condition for like 3 months, and she's tried oral analgesics, massage, and it didn't work, and so I've offered to give the injection. I hope she'll be happy. Okay, now this is 5 minutes after the injection. You see much less triggering. Yeah, the second video, the second part of this video is it's also from this lady. Here you see the tendon involved is the extensor carpi radialis brevis tendon. Here I'm testing to confirm the diagnosis by asking the lady to dorsiflex, standing up and dorsiflex against the surface of the table, and the other way is to actively dorsiflex the wrist with the elbow extended. That should elicit the pain. Now, once that confirms the diagnosis, once the diagnosis is confirmed, you can proceed with the injection, and That's the area of the side of the side of the injection. I swabbed that with butane iodine and alcohol, and again numb with ethyl chloride spray, and give you injection. Here I've added on top of the 0.5 cc of triamcinolone, I've added another 0.5 cc of lignocaine 2%. And here I was able to do that because you have a bigger surface area to play with, and hopefully that lignocaine would sort of numb that area, so in that help with the pain relief while waiting for the triamcinolone to work. You can also immobilize this joint with bandage, elbow support, or bandaging robotic style, like a robotic joint. I didn't do it this time because the other hand is already bandaged, so it's not practical. Alright, dorsiflexing after the injection did not elicit any pain, so well, I hope the patient's happy after this, and thank you for watching. I hope this video has helped.